are skill-based. How long does it take to develop skills? How much practice does it take to develop skills? So being an active participant in the process is vital. You can't expect to just take a drug and magically it goes away. It doesn't work that way. So I'm going to be very specific then about things to do, and I'm going to be equally specific about things not to do. And then if we have time, we'll see how it goes. I'd love to be able to spend a little bit of time talking about the concept of prevention. We've learned enough about depression to be able to speak intelligently about prevention. And in fact, we have set up prevention programs, tracked them for years, and have plenty of data to show that when people learn these skills, that it makes a difference preventively. Well, there are three primary forms of treatment. The first is the use of antidepressant medications. As I just said, currently the most popular form of treatment. It is remarkable how quickly these have become integrated into society at all levels. Drugs that have achieved the status of being a rock star. People who are so casual about Prozac, they call it vitamin P. And it is something that people are so enamored with, but really don't have a basis for evaluating in terms of their merits, the pros and cons. The second modality is, of course, psychotherapy, the various forms of talk therapy, and then self-help regimens. Let's talk about each in turn. First thing to know is these forms of treatment are not mutually exclusive. And I can say flatly, part of what we've learned about antidepressant medications is, while they can be valuable for people, it is a disservice for somebody to use antidepressants as the sole form of intervention. It's unfortunate that people just take the medications, but I can tell you flatly, it has the highest rate of relapse of any form of treatment, as you would predict if you think about it. There are certain things that medications simply can't begin to address in a person's life. I'll be specific about that as we go. Secondly, psychotherapy is valuable, just as medications can be valuable, but it's variable. And one of the things about psychotherapy is it's really only as good as the therapist you're talking to. There are some therapists who are wonderfully experienced in doing treatment for depression, and then there are some people who really don't know all that much about it. How important it is to be a smart consumer, and I'll talk about how to shop for a therapist a little bit later on. And then last, when I say that self-help is not only desirable, but it's essential, nobody can do this for you. It's one of those things you have to be proactive in doing. Now, there are other common biologically used treatments. They're less common than medications, but they're not uncommon. And just to be able to highlight to you that the research in the world of biology goes on. When we look at the factors that contribute to depression, they operate in three primary domains. There are the biological contributions to depression. There are diseases where depression is a predictable consequence. There are medications where depression is a predictable side effect. Biology matters. But as it turns out, the more that we learn about the genetics of depression, and I'm talking specifically about major depression now, it turns out that biology is a contributing factor, but not nearly as strong a factor as people have assumed. The Human Genome Project, which has mapped human DNA, has made it quite abundantly clear that the genetic contribution is only in the neighborhood of about 30 to 40%. Now that's significant, but it's not overwhelming. What I'm now saying is that the factors that most contribute to depression go beyond biology. Biology is part of the story, it's not all of the story. So the fact that other biological treatments continue to be developed is valuable. There are people who have very severe depressions that don't respond to medications, that don't respond to psychotherapies, and continuing to evolve other forms of treatment is an important thing to do. So they are collectively known as the brain stimulation techniques, and that includes electroconvulsive therapy, what many people call shock therapy, a newer form of treatment called transcranial magnetic stimulation, in which people are exposed to magnetic fields, vagus nerve stimulation, which is essentially a pacemaker for the brain. You literally have an energy pack, a battery pack, surgically inserted in your chest. The leads are attached to the vagus nerve, which goes up to the brain. It sends an electrical pulse every 5 to 10 seconds. Magnetic seizure therapy, using magnetism to induce seizures as opposed to electricity as in ECT. And then the newest and currently only experimental form of treatment, deep brain stimulation, where electrodes are inserted deep into the brain, again, electrical impulses to stimulate the brain. Now, these are certainly less common, much less common, but they're not uncommon. And in fact, Australia was one of the research sites for some of the newer forms of treatment, especially transcranial magnetic stimulation. So that is an important thing to appreciate, is the research goes on. But I don't know of any depression expert who would realistically say that any one of these biological treatments is in and of itself going to be ultimately enough. That's why it becomes so important for people to have a realistic view of depression. There's plenty of evidence to show that the people who are educated about the nature of depression, the signs, the symptoms, the treatment approaches, do better than the people who aren't educated. Remarkably, though, there are people who will come to see me. I'll ask them, okay, have you taken any medications, or have you been prescribed any antidepressants? And they say, well, I'm not sure, gee, here's the pill I'm taking, is this an antidepressant? And I find that remarkable, that somebody would be taking a medication and they're not even sure what they're taking, much less why they're taking it or what's supposed to happen. It's very important to have a realistic sense of what you're dealing with. Let's talk about the issue of diagnosis of depression. Are you in fact depressed? Well, people bandy about the term. People will say, the Broncos lost, I'm so depressed. Is that really depression? Well, the issue of diagnostics is actually a little bit more difficult than most people realize. Depression is a soft diagnosis. We have a manual that is called the Diagnostic and Statistical Manual. Amazingly, there are 227 different symptom combinations that would all correctly yield a diagnosis of depression. So what that really means is, in some ways, depression's in the eye of the beholder. But when we look at the diagnostics, it's important, what this slide's about is the fact that depression manifests in different ways. There are different forms of depression. Far and away, the most common form of depression is what's termed major depressive disorder. Just depression, unipolar depression. Dysthymia refers to long-term depression. Diagnostically, when somebody's been suffering depression less than 2 years, they're just called depressed. Once they cross that 2-year mark, they graduate into what's called dysthymia. Same symptoms, just a longer period of time. Bipolar disorder, what used to be called manic depression, where the person experiences, instead of just one pole of the mood continuum, hence unipolar depression, bipolar, the person will hit either extreme of the mood continuum, highs, lows. Now, the misconception is that for every high there's a low. It doesn't really work that way. Somebody can have one manic episode and 100 depressive episodes and still be correctly diagnosed as bipolar. Unlike depression, bipolar is a different animal. Where I said the genetic variance for depression is between 0.3 and 0.4, the genetic variance for bipolar is between 0.7 and 0.8, a much more biologically based phenomenon. Consequently, I don't know of any mood expert who would suggest you can treat bipolar without at least some use of medication. And then seasonal affective disorder, which is unknown in Queensland. So what I'm really focusing on tonight is major depressive disorder. But just to define it for you, seasonal affective disorder for the people who live in northern climates. I mean, in Scandinavia, Canada, North